As you probably saw, if you had a chance to look at the couple of articles that we had listed for you today, you saw some of the movement that I'm wanting to make into a little more of a constructive conversation around, with some of the critiques that we've been looking at. What are the possibilities? I mean, if we're, with the concerns that we've discussed the last couple of times together around the therapeutic culture and some of those issues and the individualism, et cetera, and how might we address that? What could we do differently? How could we maybe think? And going back to one thing I'd mentioned to you in the first lecture along these, or the first conversation we've been having along these questions, would a better question be, how might communities of faith and spiritual practice support and foster human flourishing? Rather than, remember the one of the pictures of, does God want me to be happy? Does, some version of that, and the sort of seduction of some of that, versus that, if we really want to think more constructively about this religion and health conversation, I want to ask, how might communities of faith and spiritual practice support and foster human flourishing be maybe a better question? And when Warren Kinghorn's essay, if you had a chance to look through any of that, I think you'll see Warren, and let me give you a little bit of the context on Warren. Is a delightful young man. He's I confess, he's one of my all-time favorite students that I've had. Warren was a medical student at Harvard the first time that I came in conversation with him. And Warren was calling me from a phone booth. This was from a phone booth in Boston, and was letting me know he was a very, very polite young man. He's from South Carolina originally, so that's why he's polite. And he was very polite. He wasn't from Boston originally, but I'm sorry. Yes, forgive me. That's true. Improper generalizations there. I'm very sorry. And so he calls me, and he's like Dr. Meador, and and starting to explain his story to me, clear to me very early on. Very bright young man, and he's telling me that the divinity school at Duke has told him that let me step back. This young man's decided to take time out in the middle of his Harvard Medical School career to do study at the divinity school, to do theological study, and taking it very seriously, and is calling me to tell me that they have told him in the admissions office at Duke that some way he didn't get some form in on time. It was a day late or something like this, and his admission was not being considered. And I'm like, what are we thinking? How can we? Warren is special. He's a distinctive young man full of opportunity. So anyway, long story short, ended up working out his admission as well as financial aid for him. And thankfully, he came to Duke rather than to Boston University to do his theological work, and from our perspective. And he did an MTS, then went back to Harvard, finished medical school, then came to Duke and did a residency with us in psychiatry after having given sort of the commencement address, the student commencement address, having been chosen by his colleagues at Harvard for the student commencement address for their graduation. And then he's gone on, joined the faculty as a junior faculty person, and has completed now the THD, and has joined the faculty doing very similar to some of the things I used to do jointly between the Department of Psychiatry and the Divinity School there at Duke. Anyway, very special young man, and I'm very thankful to see him continuing to do some of this work. And as you might guess from looking through if you did have a chance to look at the essay, his dissertation for his theological doctoral degree focused around some of these issues in relationship to Thomas Aquinas. But interesting, and what I want to focus on out of this essay in particular that Warren gave us and sort of build on some, is when he talks about, when he uses the language that in some ways most constructively that a religion and health movement, this movement we're talking about, would understand itself most broadly and I think most optimally, even not just from a Thomas perspective, but this science of human flourishing. The phrase, if we really, I want to offer that and encourage you to ponder that may be a more optimal way of thinking about this, what gets lumped into the religion and health movement. Well, if we really want to have a science about it, but a science of human flourishing, and what would that be like? What would that look like? How would we talk about that if we're going to talk about human flourishing? Going back to then remembering some of what that we'll talk more today about, but this notion of the ends. What does human flourishing look like to you? What do you view as good ends? What do you want it to be? Yes, ma'am.
Would the Greek ideal of sound mind and a sound body ring true here?
I think some of that would. Bringing those together, and when you mention sort of Greek notions, I want to bring up the phrase eudaimonia. Is that a phrase? Anyone? Aristotelian. The Aristotelian notion of, it's a much richer phrase that I think captures some of what you're talking about as well as though, and one of the things that we're going to be looking at a little bit later is the notion of that sound mind and that sound body habituated in the context of a community, of that contributing. You know, one of the things that you guys, when we talked about, when we were kind of talking about among ourselves, ideas around this, either last week or the first week, and many of you talked about some version of giving back. That really how you, and I think that shows some of the wisdom of the years that's represented in this room. But I was impressed with the number of people who, that in some way wanted to bring together, yes, that sound body and sound mind, the fullness of, but in the context of then contributing back out of that, giving something to a broader community. Yes, ma'am.
A couple of weeks ago, you asked about the definition of health.
Mm-hmm.
I don't think we got an answer, but in the old model, Rene Descartes, of course, said that it is the absence of disease. And of course, now we understand through neuroscience, and we learn more about the brain, that we're a continuum. So the definition today is sound mind, sound body, sound spirit. So we talk about the spirit-mind-body connection, and they say that you have to have, I'll put it shortly,
That's okay.
sound mind, sound body, and a
Sound
good
spirit.
spiritual life.
I think that's absolutely getting at some of that. I'm glad you brought that up. I didn't include that slide today, but I have a slide sometimes where I use that challenging that absence of disease. The vision we want of health, and when we're in health, and I would want to say health and human flourishing, is much more full and rich than absence of disease. Now, and I would want to say also, and I want us to work together to even make it a little more thick, if that notion, thick and textured, rather than even just sound body, sound mind, sound spirit. Nothing wrong with that. That's good in many ways. But I want to even give that more substance of how that comes to be and what human flourishing would look like within that. So in order to get at that somewhat, when I say, remember our sort of title for our time together of Pitfalls and Possibilities. Well, I want to start really thinking about possibilities. Some of the possibilities that, and two sort of orienting approaches on that. One, the community as a context, going back to the science of human flourishing in the spirit of some of what you guys have already been mentioning today, the science of human flourishing. So the community as a context for that sound mind, sound body, and sound spirit, and then that fullness of that person that we're talking about would be involved in a formation and interpretation of the person. How many of you probably know, if you listen to the radio at all, you couldn't have missed it. How many of you have heard the ads for personalized medicine? Some sort of personalized medicine in Nashville and Vanderbilt, right? And it's cool stuff. I must confess, that's some Kool-Aid that I have drank. Okay, the Vanderbilt Kool-Aid along personalized medicine. but I want to nuance it in ways. And one of the things that and Jeff Balzer is so embracing of that while the fullness of what we're doing with genomics, etc., I mean, it's rich with possibility, but always one of the pleas I want to make is, what about the person in personalized medicine? I want to challenge us to not lose sight of, yeah, we want all the fullness of what we can learn with genomics, but if we're going to do that well, and Jeff could be more supportive in so many ways, but I want to make sure we don't forget the person in personalized medicine. Okay? If we're going to talk about personalized medicine, let's really talk about, and because that's how we're really going to learn a lot, is talking about the person in personalized. So, two of the core possibilities that I want to sort of anchor our ongoing conversation around, of thinking how can we most optimally think about this notion of religion and health, and using sort of Warren's modifications on this science of human flourishing. How can we think about this notion? Well, the community as a context, and then formation and interpretation of the person. That religion and spirituality contribute to the formation and interpretation of the person, and that they are manifested most fully in the community as a context. So when we talk about the community, excuse me, Barry has, if you were able to read the Health is Membership essay, Barry has this quote that I want you to think about and take home with me. Health is not just the sense of completeness in ourselves, but also is the sense of belonging to others and to our place. It is an unconscious awareness of community, of having in common. Now it's not contrary to sound body, sound mind, and sound spirit, and the very the breadth that starts to interject, which I think is so much better than the old absence of disease, but it's also adding in of a fullness of the community as a of belonging, a sensible. I would propose to you that someone could claim to have great blood pressure, great control of any sort of metabolic syndromes that might be possibly out there, etc., and so many other aspects of what could be measured with an appointment in the medical center, and they could still be profoundly unhealthy, and lack flourishing. And one way possibly of getting at the deficit would say, because if you sat and talked to them, and all of those chemistries and measures were great, but when you talk to them, they acknowledge, I don't belong. I don't have a place. I don't understand. I don't know. I think that would be a major deficit. I think there's a missing link there when there's a lack of belonging. And I use that language. There's a lot of ways we can frame some of this, but I do think the notion of belonging is so important. One of the contexts in which I work with this at this point in time is a program that I direct for the VA. I don't really work with the VA here in Nashville, but this is a national this is based out of central office in D.C., and it's a program called Mental Health and Chaplaincy that we have. That's where we're trying to develop a capacity for mental health for chaplains to be very much part of the structure and fiber of mental health clinics and interventions across the VA, and we're actually working with the DoD some as well. We've had some collaborative efforts with them over the last couple of years, because I am convinced that some of what we see that we talk about with moral injury, I don't know if that's a phrase that's familiar to you, but the notion of literally the struggle of many persons that are coming back from war zones with, what have I done? What have I become? How has this changed? So it's part of PTSD, but it's a variant on that in some ways that has particular relevance to the sense of their spiritual and moral lives that's not frequently cared for well in the standard mental health context. And it's not that the providers don't care about it, it's just we don't have the right equipment sometimes as mental health providers for that. We don't have the right background, et cetera, for that. And then along with those, one of the things that we continually find, and I bet you've heard this some, if you've ever had veteran friends or maybe if you've been a veteran yourself, et cetera, of when coming home, we frequently hear some variant of, I don't feel like I belong now. I don't know how to fit in again. You know, the family unit's changed, right? No longer mom or dad that's been absent. The family had to go on working without them, and now they've come. They don't feel like they belong. The community doesn't know how to relate to them. Sometimes, a variety of ways. But I just use that as I think a somewhat vivid example of, but still the notion of not belonging. If we feel like we don't belong, I think that's a detraction from our health. Yes, ma'am.
And I think that's related to two phenomena. One is when they're in the military service, their family is their unit. And then when they come home, they feel a sense of isolation, which leads to the higher suicide rate.
It's absolutely true. Oh, I'm sorry, I thought you were going to say something. No, I think that's absolutely true. I mean, and you've mentioned it, so I'll just kind of a bit of a sidebar, but I think it's poignantly painful to me, the elevated suicide rate that we've seen over the last couple of years, both on the DoD side, in active military, and in the VA. I mean, painfully so. And I don't know if any of you saw the Time magazine about, I don't know, 2 months ago, or on the front, I mean, sad stories of young people committing suicide who were feeling like were so desperate and unable to either get help or unclear on how to access it. One of my real concerns is that I think persons who become that distressed, again, this goes back to my mental health and chaplaincy work, so many of them need someone from a spiritual perspective. Not everyone, but many of them need someone to try to address, I think, those really significant existential issues that present themselves prior to suicide and that sort of thing. We've not been meeting those needs. I think some of what we're talking about in this series of times together is relevant for a certain solid number of those people if we're going to really address this substantively, this intersection of religion and health. So the notion of a community, awareness of that, and of belonging and having in common. This is, I mean, to be frank with you, I'm genuinely not politicizing this at all. I'm not claiming it's an easy answer on either end of the political spectrum. But if we're going to address the real health disparities, but also just the quality of health for all of us, even if we have total access, even if we have access to good health care, etc., we have got to be thinking more along the lines, I think, of that our health is something we share in common, in a community, that your health is interdependent with my health, and that we literally have to have that frame of reference and that mentality versus the idea that, well, as long as my blood pressure is okay, that's all that matters. You know, and that's seductive. That can feel like, well, Keith, isn't that what really matters? But I would propose to you that we ultimately are all vulnerable to a decrease in health if we aren't thinking this way. It may not be that your lab values will show up at the next appointment negatively, but I think our health, in its most full sense, will deteriorate if we're not thinking along these lines. So the centrality of the community as a way of thinking about health, and then working with me to think about, and then what does religion and spirituality, how does it contribute? Or sometimes not contribute, to be frank with you. I mean, and let's acknowledge that. I want to take this opportunity to make sure that we're all, I think, honest with ourselves about, I mean, how many of you have ever known a religious community that excluded someone and made them feel like they didn't belong? Right. And I think that's detrimental to health. I mean, I can absolutely, I mean, one example that I was talking with one person here before was about and I mean, I know you guys have so many, you could give me all variants of this, of a gentleman of years ago, and regrettably this was in Nashville actually, that I got this, that the story was told to me about, of how he had been diagnosed with cancer. He was a member of a Bible study group, okay, in the Christian context. And he'd been a member about, and so everyone was all rallying for him and was behind him and this kind of thing. And so he got treatment, went into remission, okay? So then everybody's excited about that, right? Everybody's rallying. Well, then he had a relapse. And painfully to me, they started, well, what did you do wrong? You know, what did you do wrong? I mean, what, you must have some problem. I mean, at that moment when what he desperately needed was that community and a place where he was loved and belonged. And we're going to talk about love today, sorry, but we're going to talk about love too. But a place where, at that moment when he needed it most. And I'm not saying they were mean people, but they were profoundly misguided, I think. I genuinely believe that. And so that was a destructive contribution. So I want to acknowledge, and I see that most of you will understand but I want to be very clear that I think in the context of what we're talking about, religion, spirituality, the fullness of that domain is important in relationship to health and human flourishing, or I wouldn't be here today. I do believe that. But the valence can be positive and negative. And that's what we have to keep in mind. I think it's what the model for thinking about in some ways is that I believe religion and spirituality is a powerful part of the psychosocial determinants of health. All right? And I believe in psychosocial determinants of health as being central to how we understand that personalized medicine about the person in personalized medicine and the fullness, et cetera, that we'll keep talking about in various ways. Okay? But religion, it can be positive and it can be negative. So the interesting part is us think, part of what we're kind of moving into today is thinking about what are some possibilities of being positive? And that's when the community offers a positive valence about this as a place of belonging. Belonging to others and giving us a sense of place. We yearn for it. I think there's a lot of diversity in people's experience of that. And I acknowledge that. And I mean, how many, I promise, I have had more times than I wish I could, than I can count, and wish there were much fewer, when I've been seeing a patient in the office, and okay, we've tweaked their antidepressants. I mean, their core symptoms of depression are better. You know, when I say core symptoms, like major neurovegetative symptoms, they're sleeping better, they're eating better, they're concentrating a little better, etc. But you know, what they really need is a place to belong. What I yearn is to write a prescription for belonging, a community, and I can't do that. Or it'd be worthless if I did. But that's what I mean, and I've said that before to some folks. I've literally said at times, I said, well, you know, we've made progress, but what I really want to do, I mean, you need friends. You need a place to belong. Yes, ma'am.
Anthropologists said that we instinctively belong to tribes to survive, and that we need a sense of belonging to be mentally healthy. And the Latin word cum, C-U-M, literally means to join together, to be part of. And social scientists say that when we're part of a community, we not only share our stories, which is what connects us, we're able to empathize with other people, but it also furthers and betters the environment around us, and it's communities that are able to advance positive social issues. But they say that they have an agreed on vision, but they don't always particularly agree that communities are democratic.
Well, it's very, now you're pointing towards some very important issues, which we're actually going to talk about a little bit more over the next couple of weeks with Martin Nowak's work in a book called Super Cooperators. And very much, I mean, I love what you're saying as far as the real evidence of our yearning literally on a biological level. Okay, and all of these things I think are very interrelated, and I think it's powerful, the possibilities, but again, remember the potential deficiencies, the potential. If you don't have this, what does that mean? What are the implications? Because it's not, even though we have, as Ms. Judd was just pointing out, some of the biological formation and literal yearnings for this, perhaps embedded on an even evolutionary basis, but it's not always present in some ways. And what are the implications of that? Yes, sir.
Do these people that you're talking about, don't they belong to faith communities, and can't they rely on them to support them?
Well, I think some of what I'm wanting to point toward is the possibility of belonging in faith communities, and that's exactly what I'm wanting to sort of build some evidence for and some argument for, of the potential benefits of thinking about religion and health. But I'm just wanting to acknowledge sometimes even those communities can be destructive, and I need to acknowledge that, right? Can be powerfully destructive.
Like those who asked this man who got cured from cancer and then relapsed, what did you do wrong?
Yeah, exactly. I think they actually had a very very negative effect for him, and that's painful. But that doesn't change the reality that there's still a lot to be understood and potentially appropriated out of communities of faith and religious practice that really can be related to health in a profound way. But yet we've got a lot of work to do to try to understand that better, and what are the characteristics of those communities that contribute most positively in some ways. And that's some of what we want to talk about. What are the virtues? What are the characteristics of communities that will foster positive possibilities of belonging and of being a place of formation in health and human flourishing? See the phrasing and where we're going on that? So I shared this with you partly, some of you may have seen it before. It's kind of one of my old favorites of a graphic representation of community health. We're very prone, those of us particularly who work in tertiary care centers or hospital settings of any kind, we kind of, I don't have a pointer with me, but we tend to, am I attached? No. We tend to live on this outer edge. We tend to think that health care, that caring for, that human flourishing, health and human flourishing, we're frequently captive to the idea of thinking that it's in that periphery. Well, we treat stroke, we treat cancer, HIV, diabetes, suicide, COPD. That's what we do. That's health care. That's what and the truth is that's what tertiary healthcare systems do work with a lot of the time. But what I want you to sort of get a graphic sense from this with me is that, okay, but what contributes to those? And this public health model by Dr. Johnson would say alcohol, substance abuse, firearms, motor vehicles, diet, activity patterns, tobacco, microbial agents, illicit use of drugs. So those kind of social, contextual, community-based activities. I mean, we know this, but we don't get it still. So much of what contributes to what we call, the expectations in healthcare are practices in the community. They're things we do, things we engage in, how we don't care for one. And then go one more step in what he calls the 8 root causes of death. Internal external stress, meaningless existence, economic despair, hopelessness, powerlessness, low self-esteem, lack of information. Those are things we can all be part of. Those are things we can be about and think. And if we think about those root causes and then look at this graphic representation of how they go out to all of these things that we have clinics for, right? We have the pulmonary clinic, the cardiac clinic, the liver clinic. We have clinics for all these. But if we could think a little more a little more creatively, what a difference we might make, especially if we really grasp the significance of communities of, again, faith and practice when we're thinking about religion and spirituality, and their power in people's lives, and a place of belonging and how that starts to have a real impact on economic despair, meaningless existence, hopelessness. If someone has a place they belong, they don't have to be rich. I'm sorry, I don't think they don't have to be rich to deal with hopelessness. They don't have to. Meaningless existence is not dealing with meaningless existence is not dependent on what we so frequently, what I would like to say is sort of the captivity of this technological utopianism and consumerist framework. It's not contingent on that. I sincerely believe that a community more like, sorry, I can't go back. A community more like this really does address those 8 root causes. Yes, ma'am.
How does sexual behavior fit on the accident?
How, as the actual causes of death? Or so, well,
What is the relationship between sexual behavior?
I think that's what that's mean is certain forms of sexual behavior that end up, STDs.
Oh,
I mean, if we're, that's not.
I can see firearms and suicide.
Yeah, I think he's just shorthanding here. I mean, he's not meaning all sexual behavior. No, that's a no. It's a good question, though. I mean, no. I mean, so we want. That's a contributor to the belonging. Okay, that's a positive in the positive ways. But I think what he's meaning by there are more the problematic aspects of spread of disease and this kind of thing when that's involved with sexual behavior. Well, could be.
But economic despair is one of the root causes, though. There is some level of need and not rich, but you don't have.
Right. Yeah. I'm not meaning to. What the point I was trying to make was to have meaningful existence doesn't require being rich. Economic despair, I absolutely see as one of those root causes, and I mean that's part of. It's fundamental to, I think, addressing those issues. I actually didn't keep the slide. I mean, I should, for you, bring back in the slide around. There was a great article in the New Yorker last year about literally, I mean, the evidence, and I mean, we all know this, but good, solid, data-based evidence that poor health is so closely is so correlated with just low SES, socioeconomic, with poverty, over and over again. I mean, it's not rocket science. It's addressing one will help the other. But this gets back to notions of what a community would look like, right? I mean, if we really understand what it means, to offer a place of belonging, et cetera, and not to be too redundant, then I think we get. I want to just offer this to you again, another graphic, just to, as we start to think about people. I always want to remind us, and this is an effort of just to not be captive to the individual. That we're always, it's an inextricable link here between the person to their lifestyle, to the community, the economy, all of this sort of fluidity is crucial when we're thinking about health and human flourishing to avoid the trap of my health and human flourishing and that is what's the primary driver. So I want to just this determinants of health and well-being in our neighborhoods. It's just a graphic that I just shared with you. Not super profound, but the same principle again. So our 2 possibilities for thinking about religion and spirituality in relationship to health and human flourishing that I think offer some of the most promise is one in the notion of a community as a context. A lot of work we're going to still keep doing and thinking about with that, okay? But the big picture is, one is the community as a context, as a way of thinking about that relationship, and secondly, how religion and spirituality contribute to formation and interpretation of the self, the person. So one is the community as a place and its contribution to, and it can be negative, but hopefully, but in its most constructive way, as part of a community of social support, social network, and a place of belonging. And then the other is more on the personal side, the notion of formation and interpretation of our sense of self and how our religious and spiritual lives can contribute to that, our sense of the person. Linda George, an old colleague of mine, she's a medical sociologist at Duke, has worked with this a good bit, and I like this quote from her saying that providing meaning about life's tragedies, purpose, and other existential questions is a key function of religion. And although secularization has eroded, which is something she works with naturally as a sociologist in certain ways, has eroded religious authority to some degree, I believe that no other social institution comes close to religion in providing meanings about important issues that otherwise seem meaningless. So the centrality of religion and spirituality as providing a way for framing and addressing those existential questions about meaning and purpose and a sense of coherence. Now, is it always easy? Absolutely not. We've already talked some about in past weeks together around just the profoundness of suffering and how it's not an easy answer. And we don't want to, I'm not in any way trying to propagate some notion of that. But I do think that that's a core part of what religion and spirituality offers in thinking about relationship to health and human flourishing. Again, remember the kind of the distinctions I'm wanting to make, the comparisons. It's rather than the notion that, oh, just use it as this new tool or instrumental method for cure or for making it all better or for some way of it will make you healthy. No, but I do think it can help us negotiate the suffering, the meaninglessness, the challenges that we face inevitably in life, and that is a vital and important part of the benefits. Now, I want to talk a little bit about, when we've got these notions of the importance of the community and the importance of formation and interpretation of the self and how religion and spirituality can contribute to those two, then let's talk a little bit more about how we might think about that. Yes, sir.
Yeah, before you get into that, on Linda George's...
Yes, sir.
She really talks about two subjects. One is the key function of religion, and then she says that secularization eroded religious, quote, authority. I mean, there's really two concepts there. One, religion can get an awful lot of help, but religious authority is counterproductive.
Well, I think what no, you're quite right, especially authoritarianism. Religious authoritarianism absolutely can. What she's, and it's a good point, so thank you for sort of bringing, what she's really pointing out is sort of the cultural authority of religious organizations and structures and how that has eroded over the last couple of centuries especially. Some of the things we've talked about even on the historical tendencies. So, I mean, she's noting, I think she's wanting to note that as a sociologist of that change in cultural authority. And remember, we talked about how science has become much more of a cultural authority. But I think you're quite right on the point about religious authoritarianism and how that would be a real detractor. And yes, sir. Go ahead. Go ahead. That's all right.
Well, the example I was thinking is in the 40s and 50s when I was growing up in a small town in Texas, the Baptist church authoritarianism excluded everything that young people wanted to do.
Yep. Yep.
So the end result of that, now I'm looking 50 years, 60 years later,
Yes, sir.
was that these young people developed religious concepts so their children became big members of the Baptist church and changed the authoritarian side of the church.
Open that up a little.
Yeah, developed youth programs, and did a much better job than we had done, which was, in fact, one thing I think we did good was have children.
That could, well, and so I think your point's well made, and I'm going to use another word there along with your authoritarian legalism. Sort of some of the historical sort of legalism at times and how that detracted from. Let's think about that together in just the context even of what we were looking at Barry a while ago. how many people didn't, I mean, we can imagine how many people didn't feel like they belonged, right? Because they weren't quite right. In church, in faith communities, we still do that. You know, you don't quite fit yet, so you don't belong. And what are the messages that we're giving with that? Versus other possibilities of ways of saying, okay, we have things we can offer and establish a community, et cetera, and a variety of possibilities in that. And so I think in that regard, that's more internal to what you're talking about, and I understand completely. That's internal to the faith communities and how they've addressed the authoritarianism and the legalism in some ways, right? And what she's getting at with this is more the general cultural authority of religion and how that has diminished in the culture as a whole compared to a century or two ago, and how now really whereas there was a point in time that people would have looked to theological or religious leaders for insight and understanding of how might we live in certain ways. What are the ends to which we should be living? Okay? Typically, that's not looked to in the same way, that it would have been at one point. I should have brought, in the context of this, I saw an interview over the weekend in the New York Times Magazine, but I don't know who this guy is. His last name was Boyle. He's clearly a pop figure in certain ways. And it was just, I'm sorry? And it was interesting to me how it was just one of those interviews they do sort of a figure. And it was interesting to me the level at which he, without hesitation, was commenting on how, well, we're past, and I'm paraphrasing a little bit, but we're past that God stuff. I mean, that he was literally sort of discounting that as having any relevance for giving insight or understanding as to how we might live, what might be culturally authoritative in some ways, which is interesting. And you may want to say, well, Keith, I'm right with him, and but I'm just wanting to say but I mean, I think that's what she's getting at, and it's intriguing. And then I do think it's relevant then to think of, if we go far enough, what will form our communities? What will be the context for any, I think you might have mentioned earlier, just some common sense of what we see as good? Are we in some ways losing any capacity to have a common sense of good? Do we have any shared sense of what the good is? And I think that becomes a very relevant question for thinking about healthy communities. Now, does that have to be authoritarian or legalistic? I don't think so. But some degree of common shared sense of, okay, this would be the good. I struggle. If we don't have any of that, what are we left with, and how do we start to build communities of practice in some ways? Yes, ma'am.
When he was talking about growing up in Texas, the Amish, when their children get to be a certain age, I guess they're teens, 18, 19, they go through a thing, I don't know what the right word for it is, maybe somebody knows, where they could go out in the community and do just what they please. You know, they can drink and dance and have a good time. And then after that, they're supposed to either come back and embrace the Amish way of doing things, or they leave.
Or they've made a choice. They make their own choice in a way. That's very, I mean, that is, those rites of passage in certain way. I mean, we negotiate that in a variety of ways within communities. The Amish are actually, the Amish are a distinctive group. And I want to just pull an example out of recent years, and I'm not to idealize them, but yet a moment when I was in awe of a community that's has been formed over centuries. Do you remember I may get my time, 2 to 3 years ago, when there was when there was just the attack, a number of school children died. I can't remember how many, but nearly 10. I mean, it was about 2 years ago. A number of school children died in this just horrible attack. And I know how most of us think and feel about it. And I just was awed by their response and their capacity for forgiveness and how they worked through that as a community. I was challenged to say, could I do that? You know, have I been formed in a way, am I part of a community that could do that? And I think I think it's an example to think about. And actually, I was in a conversation just a couple of weeks ago with a friend who has written on these kinds of, it's Stanley Hauerwas, who's a friend that's written on these kind of things a good bit. And one of the comments he made was, yeah, and that they were formed for that over centuries as a community. So these, I don't want us to, I don't take it lightly how do people come to the point of these capacities, but yet I take it seriously of its importance and its value. Yes, ma'am. Did you have your hand up?
Yes, sir. Only 47% of Tennesseans call themselves Protestants now. And the number one reason that they're saying organized religion is down because of legalism and authoritativism and the fact that they exclude, whether it's homosexuals. Now, I think that anytime you claim religious exclusivity, you're in fact denying your own. When I studied Mormonism, the fact they couldn't explain the fact that they don't have any blacks.
I think.
I'm sorry, in the last few years, when I went out there and studied, it was 10 years ago.
I think all of these are challenges for us to take very seriously when we're thinking about communities of faith and practice and how we participate in them and how we nurture them and what are the appropriate, how do we, but without some communities of formation, then I think we will struggle as well. There's not a simple formula for the good one, but without a place to belong, I think we will all struggle.
Do you believe that the only way to go to heaven is if you believe in Jesus Christ, which is the sort of the dogma?
Well, now that's an interesting question. So we've gone from. I think to ask that in this I would want to say that that is a statement of faith and practice that would be very diverse in a lot of different communities, and there's a lot of ways to think about, even within the Christian. Okay, I have no qualms about that. The truth is I live and practice within a Christian community, and that's where I live it out. And I think the way we respond to that question is one, there's still a lot of diversity in the Christian community of how do we profess that belief? How specific is that? And how do we trust in that redemptive work that within the Christian community we attribute to the person of Jesus of Nazareth? And so I would want to say, of course, the importance of, if I'm in a Christian tradition, that's an important story for redemption and hope. But how that gets manifested and ascribed to, I want to leave to the diversity of the many people who are represented here. Yes, ma'am.
I just keep talking, but
that's okay.
Is the concept of a higher power universally found? I'm going to give you. I shouldn't say this, but nothing's universally found. in my humble opinion. In my humble opinion, and I can't remember who said it last week, but she was right on target about the cultural particular. So many things are dependent on. It might have been you actually. You were sitting up here of that the cultural context and groups within. There's diverse. Is there frequently in many cultures some sense of a yearning, or what? No, we see that in a lot of. But to say that it's always present, I'm just not going to go there because I think it's so. I think you could find anthropological examples where there's really not a sense of that. So, but
But let's think a yes, ma'am.
I got to disagree with you. If you look at
That's
Joseph
okay.
Campbell, the anthropologist, he says that in every culture, even the most primitive, that anthropologists find religious relics, that the universal yearning of every hominid that ever lived is to have some sort of belief system in a higher power.
And I'll acknowledge that she thinks that, but I disagree with her. So that's all right, though. One of the things is I always say, and I didn't say it with you guys because I figured you're well above this and you don't have to have it said. When I used to do classes on religion and health regularly for undergraduates at Duke, I would I had an ongoing seminar that I had there, and the beginning of the class was, we're going to have a lot of disagreements. We're going to have a lot of, and our one commitment is we're not going to kill each other. Okay, we are going to be peaceable. So we're going to be peaceable, and that I'm a little more prone to believe in particularity than universality. I think there's a diversity and particularity but I understand exactly what she's saying. That there's a lot of, that's what I was saying about there's yearnings. I think frequently found in a lot of contexts. Yes, sir.
I think in this context we could remember Buddhism, which is not necessarily governed by a belief in a higher God.
Yeah, it's a good example of it.
You may want to say, well, that means they're not a religion, and therefore it's not relevant here, but it's certain spirituality.
Right, and it is an example of spiritual practices, absolutely, etc., but not as much of a notion of a higher power God. That's right. He was talking about Buddhism. He was giving Buddhism as an example that would bring to question the notion of necessarily a transcendent higher power. It's clearly a religion with significant spiritual practices and this kind of thing, but wouldn't be as dependent on a transcendent sense of but we don't want to debate all of that too much. But that's a good point, and these are things that we could spend hours on some of those things, but they're important and relevant. And we're going to make a little more strides here, and this is good. I love your conversation. That's what we're about. This is what we're here to work on together and think about together. So thank you for all the comments and thoughtfulness. I want to introduce you to, in this context of community and of the formation and interpretation as two central notions of how religion and spirituality contribute to health and human flourishing. Okay? And we're going to come back to that. I just want to remind you of that's really the thing. I want to then talk about some of how those happen and what are some of the characteristics and ways to get at that. And courage is one of the ways I want to approach it. I want you to think about courage with me. And Jonathan Lear, not a theologian by any means, he's a philosopher. He's on the Committee of Social Thought at University of Chicago, which, for what that's worth, they're a pretty sophisticated crowd. And so he's a decent. Interestingly, he has some ties to some old ties to Sewanee on the mountain down here in the south. So, but Jonathan is a philosopher, and he also is a lay analyst. He's trained as a psychoanalyst as well as but he's primarily a philosopher. And this book, Radical Hope, is a book where what he does, and I've got another quote I'm going to show you in just a minute, but he uses the example of Plenty Coups. Anybody know who Plenty Coups was? Plenty Coups was the last sort of significant chief of the Crow Indians. Plenty Coups was the person who, in the context of a very powerful vision that he had as a young man, he saw that as a sort of a claim on him to ultimately negotiate with the white man for a more peaceable transition for the Crow than an example, a complementary but very different approach was Sitting Bull. Sitting Bull was no, we fight. Plenty Coups was a person who, out of his vision, he Jonathan does a nice job describing how he embodies the courage to lead his people through a different transition. And I share this with you of just Courage as a state of character is constituted in part by certain ideals. Ideals of what it is to live well, to live courageously. These ideals are alive in the community, but they also take hold in a courageous person's soul. And I'm just using this quote to try to remind us of that dynamic tension between the individual and the community, and the sort of shared dynamic of something even like the courage to, and I'm going to share, I'll show you toward the end, the notion of what I want. Courage, I use the phrase sometimes, courage in the midst. And radical, and how that relates to hope. Because one of the things that I want to sort of bring us back to, and that we're going to be looking forward to, is the notion of, in the midst of the inevitable suffering, frailty, and vulnerability of our human life, that the therapeutic culture might try to challenge and say, we will use health care and spirituality to defeat, and we'll do away with that suffering. Well, we know better if we're wise. So what's the alternative? How do we think differently? How do we respond to that in a way that's more, I would say, adaptive and more prone to really foster the capacity for that human flourishing? How do we have that shared hope? Where's hope in the midst of all this? I admit you've heard me talk a good bit about suffering, frailty, vulnerability, and you've probably kind of, Keith, we're tired of that. I don't want to hear anymore. I don't blame you. But yet we know it's real. We know that that's real as part of our existence. That's part of our humanness. But then in the midst of that, I want to propose that we can have shared, there's a hope in that. Now, and you're going to see, I want to say that it's a lot more than mere optimism. I love the phrase that Jonathan uses of radical hope. It's not a mere optimism. It's a radical hope. And I think that's what we're really looking for in this relationship of religion and health. And I think one of the things that religion and spirituality substantively can offer in this context of a community and our sense of self and interpretation and meaningfulness in the midst of this, these are substantive contributions of religion and spirituality to the conversation of health and human flourishing. And that I think, and one of the things that I think we are seeking is some way in the midst of our frailties and vulnerability. How do we have hope? Where does hope, and where I think Plenty-Cou's an example for us in thinking about is with the inevitable cultural changes that are occurring, and then our personal lives as well, where we sometimes lack. It's hard to have hope, right? It's hard to have hope. I mean, if we're honest with ourselves, and I want us to be honest. Self-deception never gets us anywhere. Okay, so I want us to be honest. Okay, yes, ma'am.
I just finished reading a book about a man who was a POW in the Japanese war camps during World War II. And his community were other POWs in that camp. And the main theme is how the captors try to break down the humanity.
Yes.
And most of all, break down the hope. If they could get rid of the hope, they knew they could just make these people animals. And they almost succeeded. And it was the community that kept these people together, gave them any sense of humanity. And then when the whole thing was over and they were finally rescued, the people who survived, most of them had this overwhelming feeling of wanting to get back and kill their captors. The book is about one man who went through years and years and years of suffering. He became an alcoholic, and then finally he realized that forgiveness was the only way that he could get through this. And he went back to Japan and he forgave his captors. Actually, it was Billy Graham. He went to several. He became non-religious while he was in the camp, but it was evidently a Billy Graham revival that got him back.
Well, I mean, that's a powerful story. And I think that's a vivid example. What she was describing, in case you couldn't hear, and you tell me, you correct me if I paraphrase it wrongly, but a Japanese POW person who reports in a biography of how the efforts by their captors to defeat them by destroying community and their sense of humanity, and their and hope, and their capacity to sustain hope as a community, albeit amazingly challenged, sustained them, and then how many wanted to go back and ultimately a sense of forgiveness was what sort of reclaimed his life for him, and I would say, and brought him to a human flourishing.
Got rid of all the nightmares.
That's right. I mean, it helped with the PTSD symptoms, but the necessity of a capacity. See, I would propose he had to have a new community and a capacity for a radical hope. To have that sort of that, and again, another way of naming some of that. That capacity for forgiveness does not just arise ex nihilo. I mean, that just does not happen. We need each other to do that. We need a community. We need a context. We need some, and I would propose frequently communities of faith and practice to help nurture some form of that capacity in some way. And that kind of hope just does not sprout out of nothing. I just don't. And I use the example of Pleniku because of the diversity that we do have in our culture, etc., to try and remind us that for Pleniku, he's known, if you look him up or whatever, you'll know his dream and the vision of that there was going to be a transformation and a change for his people. And they could have two ways. And he led them in the path of education, formation, and capacity to negotiate out of being those kind of, and that was his, I'm grossly simplifying, but his capacity, but I like what this, if we can make the case that this stance was a manifestation of courage, we could presumably come to see how radical hope can be not just psychologically advantageous, but a legitimate response even to a world catastrophe. One of the things that I think frequently mere optimism or positive thinking or whatever version you want, I think that can easily become just thought of as a psychologically advantageous maneuver. I'll just do this in order to think more positive. And what I want to foster with us is the importance of a radical hope that's grounded in a formation through a community and a context that's much richer than just being psychologically advantageous. I want something more than psychologically advantageous. You know? I want something of a substantive radical hope that has an enduring capacity to give shared hope in the human condition for interpretation and meaning, okay, for the self. I think religion and spirituality has some of its capacity to contribute to health and human flourishing through that. Okay. Okay. I'm going to skip, I want to hit this, and then we're going to skip a few things. And we'll weave them back in over the next 2 weeks. But Aquinas understood that the first task of any practical activity is to identify its end. I want to just remind you of this challenge that I've put out to you, and I'm just asking you to continue to work it on your own, but to what ends do I live? To what purpose do I live? What do I, and you know, and I want you thinking about that. Of what are my ends? What have I committed myself to? And why? What are they? And what are an integrated human life in which the enlivened body, habituated through teaching and practice to desire what is life-giving and to shun what is harmful, displays through wise embodied practices a life that is mature and harmoniously satisfying, and that contributes to the flourishing of the community of which it is a part. So part of what I want to challenge us with is this, I mean, very much the individual part of habituated through teaching and practice to desire what is life-giving, shunning what is harmful, very much a sort of our personal dimension of that. But then going back to what, and I was intrigued with this, thinking about much of what many of you had said, of rightly so, contributing to the flourishing of the community. That human flourishing, and the ends to which you hope, I heard it from a number of you, was to contribute. You want to give back in some way, and there can be a lot of diversity in how that's done. I don't think there's any one right way to give back. But I think your naming of the importance of it to contribute was very encouraging to me and very rich with possibility, and of how you think about that. And sometimes it's within. I don't even try to list them. I think there's a great diversity within. But and those of you who might have some of the kind of the psychology background, etc., and have been intrigued with Eric's, the generativity of later life, right? The desire to, okay, how do I give back? How do I become part of this ongoing story, this new story? How do I give? And we hear these phrases, but I want to make, it's more than trite phrases. How do I give back? How do I contribute? No, it's part of the ends. If we think, I would propose to you, it is part of the ends of human flourishing. It's part of the, and another way, just to give you an example of how, you've heard me say before that I firmly believe that we can manifest and experience human flourishing even in death. I believe I have learned so much from people toward the end of their lives, etc., about how to live. People who in death can teach us how to live. That's contributing. That's giving back. The willingness to do that kind of work. That's just one example. But I think there's a lot of those examples that if we're thinking about it carefully, we're going to appreciate the fullness of that more. Today, running a little bit, I'm going to skip a few things and go on to a little bit here to round out over the time we have. Okay, but that Barry says, but if a community withholds trust, it withholds membership. If it cannot trust, it cannot exist. We've got to have trust. I worry a little bit whether we have trust. I think it's hard. We're not good at trusting these days, and I think, but I just want to challenge us with that of what would it mean to foster communities that can trust and then belong together. I love this. Roberta Bondi is a woman who's a professor at Emory. It's kind of an old book now, but it's still a great book. And it challenges us in religious and spiritual communities, I think, in some constructive ways, and goes back to some of the things we were talking about earlier of, if becoming friends of God means we are to love what God loves, we need to bear in mind that God loves people. We must also come to yearn for the things God yearns for, including the well-being of the people with whom, left to ourselves, we would rather not share the kingdom. And we've all been there, right? It's a common experience, but I think she's challenging us well there of the temptation to not love, and I want to bring in this notion of, along with some of what we've already been talking about. We've talked about courage some, and I want to talk about and when I'm talking about love, please forget, I'm not talking about sappy sentimentalism, etc. I want to talk about a robust, textured love and what that will look like. And I'm even going to want to propose that your doctors should love you. And that's not, please, I'm not talking about inappropriate boundaries or anything like that. I'm talking about a textured, robust, sensible. But if we're going to love people, we've got to know them, right? I love this. Caring for people is easier when you know their. I want to say, caring for people is only possible when you know their history and their story. This is actually the advertisement for a hospital up close to where my parents have lived in Kentucky, and I actually know this gentleman. Look at the pocket protector in his pocket. I love it tells so much there. Yeah, but if you're going to care for him, because I know him, I love it. If you're going to care for him, you need to know him. You need to know him. And I'm really not trying to be Pollyannish about healthcare these days, because the truth is that I'm aware of how, I mean, literally, so many of our primary care providers, et cetera, are being told, you've got 10 minutes. You've got 10 minutes, and you need to keep the trains moving if you're going to meet your productivity for the day. I feel like so many of our very good healthcare providers have been made into production workers. I remember my, again, small town in Kentucky. I mean, they used to hear about people working in factories who would talk about being production. You know, you had to turn out so many a day. You were expected to especially in textiles and things like that. Well, I feel like healthcare is becoming more and more like that. But I want to challenge us that if we're going to do this, we're going to need to know people. And one of the things I want to talk about knowing people in a way that genuinely connotes them being, that involves a love. We must recover from our spiritual traditions, and I'm bringing this into health, the models and methods of knowing as an act of love. Education of this sort means more than teaching facts and learning reasons so we can manipulate life toward our ends. Not to manipulate. It means being drawn into personal responsiveness and accountability to each other and the world of which we are a part. That's a different kind of knowing. I want to say that if we're going to care for this gentleman, we need to know him in a way that is this rich and textured. Yes, ma'am.
Okay, I'm going to be courageous and disagree with that.
Okay, go ahead.
What I'm going to say is, why can't we just love him because he's another human being? Why do we have? Because to me, sometimes in knowing, you're trying to see, does this person fit a certain group of qualities or whatever that makes me feel a kinship or something about him that I can specifically relate to, rather than just loving him because of his person.
Okay. I think we may be in more agreement than disagreement. If I can modify just a little bit, I want to say, I don't think we ever love in the abstract. It doesn't. When I'm talking about knowing, when I'm talking about this kind of knowing, I'm not talking about knowing in a way that I'm kind of assessing you of, well, do I know you well enough to this, or do you fit with this or that? It's really just asking to have attended to a person, to have enough to. I think when we talk to love in the abstract, in my opinion, disembodies. It disembodies. It makes it non-particular. And I want to say, if I'm going to really love someone, I got to know them enough. I mean, I don't have to agree with them or anything, but I have to. I need. It's a particularized person, and we may be playing semantics here, but go ahead.
So to continue our dialogue.
That's all right.
So at one point, I had an argument with somebody. They were teasing about that I'd have a long conversation with a wrong number on the phone, and they said,
You do.
Me.
It's a wrong number and you have a long conversation. You're just like my wife.
Okay.
My current wife, I mean, she thinks convenience store people want to talk to her. I'm like, Katie, they really don't want to get to know you. Anyway, go ahead, I'm sorry.
But the point is, the person said I was promiscuous in my friendships. And I said, I'm glad. Because, it's like, why treat people different if they're lower middle class, if they're black, if they're green, if they're whatever?
Amen. We're in more agreement. Please, no, we're in agreement. I'm talking about being willing to know and to love no matter what. So we're in agreement. But again, not in the abstract. See, what you do, even if it's the wrong number, you want to get to know them. You want to talk to them a little bit and find out more about them. Yes, ma'am, in the back.
I guess I would use the word acceptance.
Mm-hmm. Yeah, it's a good word. Very good word. There was someone over here, too. Yes, ma'am.
I would just like to say, as far as getting to know someone, I respectfully disagree with you. That person
That's
in
okay.
the convenience store, your wife made the light of their day.
Oh, I'm kidding. I'm delighted she's that way. No, you.
People like your wife who are willing to talk to opposed God love. One of the things you had up there a while ago about, maybe not wanting to share the kingdom, I always love the faith saying that God loves the poor people best because he made more of them.
Yeah. Yeah. No. That's well said, and please don't misunderstand. I was joking about my wife. My wife, I is very dear to me, and I learn from her when she's sort of going on and on talking with them. I'm like, I'm kind of protective for them. I feel like they don't. Well, anyway, but I hope I trust you're right that they actually love to talk to her. But
being recorded.
Thank you for that reminder. I could be in trouble now. We'll come back. But I want to leave you with a couple of final. We learned to sort of tease you toward Hannah Coulter. As I told you before, please, if you don't do anything else with me all semester, all 6 weeks, whatever we have, 5 weeks, please read that. We learn these things by our grief, by our loss too. We become more communities by our grief. We don't need to run from our frailty and our vulnerability. We become more human, more whole. And we will come back to some possibilities through. I want to challenge you with courage to hope in the midst, capacity and will to love the other. I think these are two crucial possibilities through habituation in the virtues. The courage to hope and the capacity and will to love. I think it will make a difference in the kind of communities that are formed and that we're part of, and the possibilities for health and human flourishing as participants in living out in those communities. I'll see you next week. Thank you.